Hello, everyone. My name is Steven Benitez, and our research is on qualitative analysis for hand hygiene. I am going to do discussion and implications. Regan Dowling will do method and organization. Lauren Fieldberg will do results and conclusion. Leah Schling will do global issues and recommendations. And Sydney Staunton will do introduction and conclusion.
Introduction. The article we discussed for this assignment is Nurses' Perceptions on Reasons for Persistent Low Rates in Hand Hygiene Compliance. It was written by two nurses, Nohim Sadul Rios and Graciela Aguilera, employed at Baptist Health South Florida. The common interest of this article is hand hygiene compliance among healthcare workers. This contributes to the spread of healthcare-related infections and complications among patients. Not only is this a major problem in the United States, but around the world. There have been multiple studies amongst nurses in healthcare around the world with results showing that hand hygiene compliance rates are not optimal. The aim for this study was to explore the reasons for persistent low rates in hand hygiene compliance and ways to improve. Nurses pointed out that workload, amount of staff, and time as main problems that contribute to low compliance. Also, inconveniently located sinks and hand sanitizers were difficult to access. The article provided information about what healthcare providers should do to improve hand hygiene compliance. The results advise that if nurses have more time, cleaning products available at point of care, and easy accessible sink locations may encourage the compliance with hand hygiene, along with adequate nurse to patient ratio. Implementing critical care nurses' recommendations, as suggested by researchers, may contribute to the improvement.
Methods, research design. The qualitative approach used for this study was an exploratory descriptive survey. Since it was a survey, this research design is appropriate for the study. Nurses' firsthand experience with hand hygiene can be high workload, which can emotionally damage the nurse. An emotionally damaged nurse will least likely to comply. The topic does lend itself to qualitative research methods because it was an open-ended survey, such as a grounded theory design. The protection of participants. Participants are protected in the study because the completed questionnaires that were sent in anonymously. This way, there are no breaches of participants' names, which also means no demographics or other identifying factors were collected. And then the population sample. The accessible population for this research study was anyone willing to fill out the questionnaire at the magnet hospital they went to, as long as they were a critical care nurse. It was a convenient sampling method they used for recruitment. Participants were selected through a critical care unit. They had to be full-time nurses, so that meant they worked a 12-hour day shift or 12-hour night shift. These nurses all had the same training and demonstrations on hand hygiene. The sample size was determined by who agreed to be a part of the research study and answered the questionnaire. The research study was done in a magnet hospital with over 400 beds. Data collection and measurement. Data collection was provided by a questionnaire. The research study used a data analysis software called SPSS to analyze the answers the nurses gave to the open-ended questions. The questionnaire includes 18 different items evaluating the nurse's compliance to hand hygiene, as well as 2 open-ended questions. The open-ended questions were for the nurses to try to explain what they perceive the main issue to be and how the issue can be solved. Content experts were used prior to the study to check the questionnaires' readability, clarity, acceptability of responses, and completeness. No revisions were needed after the content experts looked through the questionnaire. Trustworthiness. This research is trustworthy to an extent. The researchers mentioned how they had content experts check their work and how the questionnaire fit all the criteria they wanted it to. There were some limitations to the study since they only went to one hospital and only critical care nurses were used to answer the questionnaire. Procedure. Nurses in the critical care unit were approached to see if they were interested in participating in the questionnaire. If they were given a copy of it, as well as a cover letter. The nurses were instructed to complete the questionnaire and leave it in the lockbox. There was no further contact with any of the critical care nurses.
Results. The nurses that were surveyed tended to select similar answers when they presented the survey. The main problem selected was high workload and understaffing. The main suggestion left on the survey was lack of time, and the main problem with hand hygiene. The second most selected reason for poor hand hygiene, nurse selected that was difficult to identify, difficulty to identify accessing sinks and lack of appropriately located hand sanitizers at the point of care. The second most suggestion that was left was that there were not enough sinks and poorly located hand sanitizers were a barrier to proper hand hygiene. The trends of what reasons were selected within each demographic were not presented because each survey was submitted anonymously with no identifying information. The theme that was found is that when there was a lack in one department of the hospital, there was a surge elsewhere. When there was a lack of appropriate nurse to patient ratio, there was a surge of poor hand hygiene. When there was a lack of sinks present at the point of care, there was a surge in poor hand hygiene at the point of care. When there was a lack of time for nurses to complete hand hygiene, there was a surge of improper hand hygiene throughout the nurses that were surveyed.
Discussion. The findings of the study indicate that high workload and understaffing contributed to poor hand hygiene compliance the most, followed by difficulty accessing the sink and difficulty in donning gloves. This is what nurses reported to be the barriers to hand hygiene compliance. There is reason to believe there are alternative explanations for the finding. Nurse negligence, a lack of time, and inconvenience are factors that affect hand hygiene compliance that nurses could be reluctant to talk about. The findings of the research are transferable to similar communities due to hand hygiene compliance becoming an international problem. The CDC says that hand hygiene compliance rates are not optimal in many hospitals across the US and other nations in the world. The WHO mentions how, despite several initiatives and efforts to increase hand hygiene compliance, 61% of healthcare workers still do not comply with best practice recommendations for hand hygiene. The article used a conceptual framework. The researcher is exploring why nurses' hand hygiene compliance is low by using a questionnaire and survey. Interventions used to decrease the chances of nosocomial infections are practiced and studied, but the researcher wants to find out why hand hygiene compliance is still low.
Global issues. In the Netherlands, a cluster randomized trial study was used to evaluate effectiveness of an intervention involving hospital leadership and increasing hand hygiene compliance in 67 nursing wards of 3 hospitals. The results: leaders involved in promoting hand hygiene compliance increases hand hygiene compliance overall. In Saudi Arabia, by using a questionnaire developed by the World Health Organization, 87 healthcare professionals were questioned their perceptions about hand hygiene. The findings revealed that healthcare workers understand the importance of hand hygiene preventing infections. In Canada, the public was surveyed their level of comfort asking healthcare workers to perform hand hygiene at point of care. Results: majority of the patients felt they would be at an increased risk for infection if healthcare providers did not comply with hand hygiene. However, many Canadians did not feel comfortable asking healthcare workers to perform hand hygiene. Hand hygiene is an international issue which is evidenced by a variety of approaches devised worldwide to improve hand hygiene compliance. 61% of healthcare professionals do not take the right steps to wash their hands in the whole world.
Implications. The results of the study suggest that nursing high workload and understaffing can have negative implications for hand hygiene compliance. This issue needs to be addressed along with education and other interventions for hand hygiene compliance to increase overall hand hygiene compliance. Results show that nurses need more time, cleanser products that are available at points of care, and easy accessibility to sinks may facilitate nurses' compliance with hand hygiene. Poor hand hygiene compliance has a fatal association with hospital infections and increased financial burden for the healthcare system.
Recommendations. Future recommendations. Frequent staff meetings that assess and discuss adequate nurse to patient ratios and responsibilities. Hand hygiene should be made convenient, placing alcohol-based hand rub dispensers near point of care like at the patient's bed. Responsibility for checking glove boxes and alcohol-based hand rub dispensers before the shift begins should be given to nurses. Assign a team to evaluate the accessibility and location of sinks. Start a multi-component publicity campaign like posters and reminders on the walls. Celebrate hand hygiene efforts and improvements. Encourage and engage patients and families in hand hygiene efforts. Limitations. The study surveyed critical care nurses from only one hospital. Only critical care nurses met the inclusion criteria. Therefore, results may differ if their study is done, including a variety of healthcare workers and more than one hospital. Another limitation is that the questionnaire was administered when the study facility was going through a system-wide changes and increase in critical care nurses turnover rate.
Recommendations that I would make for changing practice would be to start by addressing the issue that nurses selected most, high workload and understaffing. By addressing poor hygiene in nurses at the root of the issue itself will see resolution. Second, I would recommend that hospitals have sinks and hand hygiene stations at every point of care throughout the facility. For further research, I would suggest that surveys are conducted across different units and specialties within the hospital, e.g. surveys in labor and delivery units compared to survey results in the critical care unit, or a nurse practitioner survey response compared to a CNA survey response.
Barriers that may exist when implementing the new recommendation of change is that there may not be enough nurses available to work. Yes, the hospital may be understaffed, but they do not have nurses on hand that they can call up to come into work. They could offer a bonus for some sort for new employees to work, but if no one's available, then the hospital will continue to be understaffed. When adding in additional sinks, there may not be plumbing available at every point where a sink should be. Hospitals could put in hand sanitizer stations instead in order to help the problem of insufficient hand hygiene. Nurse leaders can enforce hand hygiene compliance. Nurses can educate clients to perform hand hygiene in front of them. Nurses can hold other healthcare professionals accountable for their hand hygiene. With the support of one another and the consistent reminders that we can stop the spread of infection with hand hygiene can help with compliance.
These are the references used to support our claims